Hi, I'm Marcus Simpson with SurgeryPRO. Thanks for joining me. This video is directed at orthopedic physicians, surgeons, and all of their staff, physical therapists, physician assistants, etc., down the line. I wanted to give you a little visual workflow over what we do for your patients if you'd like to prescribe any one of our products that might be useful in treating pain, preventing blood clots, etc. So we provide the technologies that you prescribe direct generally to your patient. Usually we actually have a person that goes out to that patient's home. Some cases we will mail and use a video in service of some kind, but largely we actually do it face-to-face. We'll integrate with the surgery center where any disposables are usually stocked in the storeroom there. We'll take prescriptions in advance from your staff, sometimes the day of surgery, and we handle all of the billing. We handle the appeals. We handle work with the patient, compliance tracking. We provide data back to your group in many situations that for which sometimes you'll be able to bill for it. Sometimes there is a revenue center that the group can, your surgical group or physician group can realize. But for the most part, we really manage the patient. So all you have to do essentially is decide that you want a particular product on a particular patient subset, implement some sort of risk management or risk profiling approach. If you're not going to do it on everybody, then adopt a strategy. Tell us what you'd like to do, any rules and regs that you have for our dealing with your patients, and then we take it from there. We're network with a very large percentage of carriers, not everybody, but we're moving that direction, which takes out a lot of the question. If we're out of network, we generally are able to work with the patient in order to get a fair payment, a fair rate, and we can force the carriers to run treatments through network at the out-of-network level. That means, so a lot of times there are a few companies that can provide some of these technologies, so if there's no network provider, we can get the carrier to provide a network rate. And generally we won't hold a patient responsible if we can't get their carrier to do what the carrier by law had to do in the first place. We have a high focus on follow-up, making sure that the patient is well taken care of, as well as happy if there's an issue that results from usage. We will send replacements out by overnight, sometimes in person if it's an important thing, and we will go out and train the OR staff, the floor staff, the rehab staff, and the various people along the chain of command. If you want to use a, there's a particular product that you're looking to use that requires a little more of an intensive workflow. Now, that is essentially the overview. So paperwork goes to your office, templates, you script something, you send a demographic, in certain situations you'll have to disclose a little bit more information if we have to get prior auth that is more sort of labor intensive. We talk to the patient, we let them know the options, we talk to them about out-of-pocket cost if applicable, we provide the product to the surgery center, the patient is provided any sort of hard unit, usually before. If there's a disposable, it's dispensed at the surgery center, can be dispensed in advance to the patient as well. The patient uses the product, we pick it up, sometimes the patient UPSs it back to us, and we bill the carrier. We talk to the patient throughout, and your patients get a better recovery. They have more risk managed, better pain management, better venous thromboembolism management, other types of high-end technologies that can really help them with particular elements of their recovery, and that's it. Happier patients, faster recovery, better mobilization, better pain management, value add for your practice, sometimes a revenue stream, really very strong.